It's vital that patients who are taking Parkinson's disease medications receive them on time. Medicines given at the correct time will reduce their anxiety and make a massive difference to their symptoms and function. A medicines regime for Parkinson's disease can be very complicated and delicate, and once upset, can take months to get back to normal. Encouraging patients to self-medicate in hospital wherever possible will maximise the potential for patients to get their medicines on time. However, remember, if you do this, you must follow the self-administration of medicines policy guidance. So what is Parkinson's disease? It's a progressive neurological condition caused by a loss of the nerve cells in a part of the brain, which leads to a reduction of the chemical dopamine. Dopamine plays a vital role in regulating the movement of the body. Around 1 in 500 people are affected by Parkinson's disease in the UK. Most people with Parkinson's disease start to develop symptoms when they are over 50, although 1 in 20 with the condition experience symptoms when they're under 40. It's important to remember that Parkinson's disease will affect everyone individually, and people respond to their medicines individually too. And so it's really important that we listen to and respect patients and their carers as they tell us about their condition and their needs. The most common symptom of Parkinson's disease includes shaking, which usually begins in the hand or arm and is more likely to occur when the limb is relaxed and resting. Parkinson's tremor usually starts on one side of the body, but may progress to both sides. Tremor generally reduces whilst the person is physically active. Another common symptom is bradykinesia, where physical movement is much slower than normal. This generally is seen as a distinctive slow, shuffling walk with very small steps. Also, there is stiffness and rigidity with tension in the muscles, which makes movement and facial expression difficult. This rigidity can result in painful muscle cramps or dystonia. Increased rigidity on one side of the body may be caused by increased movement on the other side. Other physical symptoms may include poor balance and an increased risk of falls, loss of sense of smell, which can occur several years before any other symptom, nerve pain resulting in feelings of burning, coldness or numbness, nocturia or passing urine in the night, and incontinence, although some incontinence is caused by being unable to get to the toilet, by being unable to ask for help getting to the toilet, or by not being able to manage clothing such as belts, zips or buttons. Constipation, which also impacts on the body's ability to absorb medication. Constipation is generally caused by reduced fluid intake, either because of poor swallow or because of a fear of urinary incontinence. There may also be an impact on the patient's sex life, where men may suffer erectile dysfunction and women may suffer sexual dysfunction. There may be problems with postural hypotension, causing dizziness, blurred vision, or fainting. There may be excessive sweating, drooling, swallowing difficulties, insomnia which causes daytime fatigue, and an overall feeling of slowing down. Rigidity in facial muscles may lead to an inability to make meaningful facial expressions. This is called facial masking or hypomimia. This makes it difficult to interpret the patient's moods and intentions, and this coupled with other communication issues such as a quiet, slow, monotonous voice, slow verbal response, and stuttering may make it impossible for patients to express themselves. Freezing is the temporary involuntary inability to move and may occur at any time. When the patient freezes, they may feel as if their feet are stuck to the floor, or they may be unable to get up from their chair. Patients with Parkinson's disease tend to freeze in doorways, in tight spaces, or wide spaces, or when moving from one type of flooring to another, such as moving from a carpeted hallway to a tiled bathroom. Some patients use queuing or counting to get themselves going again, and some may put something on the floor to step over, such as a piece of paper. Other non-physical symptoms of Parkinson's disease include depression, anxiety, and cognitive impairment. Cognitive impairment may range from slight memory problems and problems with planning and organisation to the severe memory problems, personality changes, hallucinations and delusions caused by dementia or Lewy body dementia. Staff must always ensure that there is a formal diagnosis of dementia before assuming that this is what's happening, and that the problems the patient are presenting with are not merely problems communicating, as already discussed. Ensuring that Parkinson's disease medication is given on time in hospital takes a lot of planning and very good communication. These medicines are rarely due at the same time as traditional medicine rounds, and so must be particularly planned into the day. For instance, night staff may need to wake the patient to give early morning medicines, rather than letting them wake naturally, so that the whole day regime is not delayed. Remember, it is vital to listen to the patient and get a full picture of their medication, especially on admission during medicines reconciliation and the prescribing process. If the regime is upset whilst the patient's in hospital, it may take months after discharge for them to get it back in sync again. Parkinson's medicines, like any other, are not without side effects. Some of the common side effects include nightmares, confusion, hallucinations, compulsive behaviours ranging from picking at bed linen to a gambling addiction, and sexual compulsions such as the patients exposing themselves or flashing. Another severe side effect of Parkinson's disease medicines is writhing or dyskinesia. Dyskinesias are involuntary, erratic, writhing movements of the face, arms, legs or trunk. They're often fluid and dance-like, but they may also cause rapid jerking or slow and extended muscle spasms. Dyskinesia can cause fatigue, weight loss, pain, and loss of function, and embarrassment. The effects in the patient between doses, either because a dose has been missed or because a dose is wearing off, include confusion, hallucination, reduced mobility, nighttime and early morning issues where patients may need help moving in bed overnight or extra help early in the morning until their first daily dose takes effect. Neuroleptic malignant syndrome and switching off are also effects on the patient between doses. The most dangerous complication of missing Parkinson's disease medicines is neuroleptic malignant syndrome, or NMS. Symptoms of NMS include high fever, confusion, rigid muscles, variable blood pressure, sweating, tachycardia, muscle wasting, hyperkalemia, or raised potassium levels, kidney failure, and seizures. It must be remembered that the risk of death among these patients affected by NMS is 10%. For patients with Parkinson's disease, switching on or being on is when their symptoms are well controlled, and switching off or being off is when the medication wears off and symptoms return. The most common time for dyskinesia is at a peak dose, when the concentration of levodopa in the blood is at its highest, usually 1 to 2 hours after ingestion. This typically matches up with when the medications are working best to control motor symptoms and when patients are on. Sometimes dyskinesia can occur as patients are turning on and turning off. As Parkinson's disease medicines are critical medicines, it's important to quickly seek alternative routes for those patients who cannot swallow oral medicines. Parkinson's meds may be administered in liquid form via a nasogastric tube or PEG, or they may be given as a topical patch, as an injection, or an infusion. Injections and infusions for patients with Parkinson's disease contain apomorphine, but it's important to realise, as distinctive as the name sounds, these medicines do not contain any controlled drugs, and they're not part of the morphine family. If you're caring for a patient with an apomorphine pump, please speak to the Trust's Parkinson's disease nurse specialist, or visit the website on screen. This will show you videos and other resources to help you set up and program the infusion pump. So finally, please remember to always listen to and respect our patients and their families or carers, to ensure that we get their medicine regime recorded correctly, and we always give their medicines at the correct times, even if this means giving them at non-traditional medicine round times. Parkinson's disease patients are individuals, and their medicines regime is individualised to meet their specific needs.